Hello, I'm Paula Jamison. We're coming here from PMN Studios in Kalamazoo, Michigan, and I'm very pleased to have with us today Dr. Rudy Cashman from Fort Wayne, Indiana. Some of you know Dr. Rudy from previous broadcasts here from PMN. He and I share an interest in mind-body approaches to healing and health. But Dr. Rudy, you have a background in traditional Western medicine, and I'd like for you to say something about it. You were a surgeon, is that correct?
Yes, thank you for the introduction and the opportunity to come to Kalamazoo. I took a walk around today, and it's really a beautiful city. I was highly impressed. I've been here before in years past playing in tennis tournaments. Yeah, I was a neurosurgeon. I quit a couple of years ago. Did it essentially 45 years, Vietnam War included. During this time, I learned that I could get a lot of patients well by coaching them, getting them to exercise or lose weight. And that's the reason I got into this type 2 diabetes, because I saw so much of it, to the point now that it's of major interest to me. I think I can really make a difference. I think we're going to have a great conversation here.
Good. Yes, and today we are talking about type 2 diabetes. Yeah. And when you say type 2 diabetes, it's like, well, if there's a 2, there must be a 1. Yeah. So can you just say a little bit about the difference between the two first?
Yeah, type 1 generally is related to children. Okay, it's autoimmune disease. It can be, it's a little higher if you drink milk from cows, for example, because of the reaction, and autoimmune where the own antibodies attack your own body, destroy the pancreas. But the type 2 is where there's too much insulin in the body. Okay? And the reason is that the patients develop what's called insulin resistance. That's step 1, and that's where we have 70 trillion cells. And these have receptors on them. Receptors on them, and it's insulin's job to get sugar into the cell to make ATP for energy. No cell would live without energy. So, but in patients who are a bit overweight, some are not overweight. Overweight, obese, and there's about 25% are not overweight, but they have high triglycerides. Where they come in and make these receptors sticky, and insulin cannot get the sugar into the cell. That's called insulin resistance. But the pancreas secretes more and more, and more. Eventually, it poops out.
So it's exhausted in a way.
Exhaust. So now they're type 1 also. The majority of patients that are diagnosed with type 2 diabetes, that 50% of their pancreas is gone.
So type 2 is a disease that you develop over time normally. Yes. You're not born with it, for example. It's not a...
Correct. But it's being seen in children now. Yeah, it used to be, type 1 used to be called juvenile diabetes. They stopped that now. They just call it type 1, type 2. And because they're seeing type 2 diabetics, teenagers, 10 and under, 16 years old, because a lot of the nation is overweight, or obese, even seen in children today. We have, you will hardly believe this, in this country we have 40 million diabetics.
Wow.
90% are type 2. Wow. It's an epidemic in the world because they've adopted the American fast food diet.
And we're going to say more about that in a second, too.
Yeah.
But tell me a little bit about the dangers of type 2 diabetes.
This is really a great and important question. That's of my major interest to it. It causes a host of illnesses. Yeah. People who have heart attacks, strokes, high blood pressure, swollen brain, skin rashes, ovarian cancer, uterine cancer, all increased rates of that in patients who are type 2 diabetic. I can name 30 other illnesses that you get. So it is a cause of a tremendous amount of chronic disease.
So it's almost like a gateway disease to a lot of really frightening conditions.
If you can avoid this illness, which I think could be avoided 90% of the time, my God, you'd save $1 trillion.
Wow.
And this should be, that's the reason in my interest, in my focus of all the other things I do with health, my focus is really on diagnosing these people very early so they don't get it. They live 10 years longer and they avoid 10 years of complications. So I'm adding 20 years to their life.
And making it a healthy life.
And a healthy life.
And making it a healthy life.
Can be done. The type 2 diabetes can be eliminated 90% of the time in a short period of time. We're talking about a few months.
Wow.
I know this field. So I feel, if you think I'm a little bit passionate about it, when a doctor can help that many people, it should excite me.
Well, and let's talk about the kinds of things that people can do to minimize, reverse, you know, how manage, choose your word and tell me what people can do.
A lot of people think because it's throughout their family, okay, that it is genetic. Genes has something to do with it, but very little, okay? It's what they're eating. It's a food-borne disease, And if we can teach them not to diet, I don't teach a diet, a way of eating different food, and maybe exercising a little more, not a lot more, they can get rid of it quickly, quickly, sometimes weeks. Franklin House wrote a book, The 30-Day Miracle. He thinks in 30 days at the Lifestyle Institute in Arizona, you can get rid of it in 30 days.
Wow.
But you got to eat differently. You have to, can't live in denial. A lot of people live in denial and delusion that, it's genetic, it's all of my genes. I want them to know that's Rudy's good news. Rudy's good news. If you change the way you eat, you'll get rid of this plague, this monkey on your back quite quickly.
So this is a really empowering message, really, that you're saying that people can, with some education and some training and maybe some self-discipline to learn how to do some things, that they can make some changes. Tell us what they can do.
You're absolutely correct. And it's based on, not just my opinion, many books. And I can name many books. You can go to my website, cashmanhealth.com. It'd be on there, books to read. Because you're right, it's about information, about learning. But number one on there, frankly, to eat differently, okay? That's number one, and get your weight under control. Find out what the body mass index is. You can look it up in a lot of books on the internet. Your BMI, you know, are you just overweight? You could be 5 to 10 pounds overweight and have pre-diabetes. See, there are 5 stages to diabetes. And I think I like to tell them to you to start the prevention. See? Number one is called insulin resistance. That goes back to, remember, I told you about the fat in here? The insulin can't get the sugar in there. That's insulin resistance, okay? That can be...
so the body isn't able to use the insulin that it's making.
Exactly. The sugar's not getting in there. How can you detect that in its early stages? Would be by elevated triglycerides, okay? That would be one. Abdominal obesity would be another.
That little
that little
rubber
stuff right
tube
there.
you get.
And hypertension is another, okay? And that your good heavenly cholesterol, the HDL, is too low. Okay, that's another.
So your good cholesterol isn't high enough. Right.
And I tell you, a very good test actually is the serum, which for some reason they don't use it in screening. This is my point. Serum insulin. Because when you have insulin resistance, okay, the sugar here can still be normal because you have so much insulin out here, it's getting the sugar in there, okay?
But you've got too much insulin, are you saying that?
Your blood sugar is normal, but you get too much insulin. If you run an insulin test, we know you're very early pre-diabetic.
Interesting.
Stage 1. Number 2 is hyperinsulinemia, with insulin's elevated and insulin resistance. Stage 2. Stage 3, where you have insulin resistance, hyperinsulinemia, and your blood sugar is going up and down. Stage 4, you're diagnosed as type 2 diabetic, where your HbA1c, that's your blood sugar averaged out for 3 months. Your blood cells, your hemoglobin dies about every 3 months, okay? And it sugar hooks onto it. So if you get an HbA1c, you get 3-month average of your blood sugar. Got it? 3 months average of blood sugar. But your HbA1c doesn't elevate till around stage 3 or 4.
Oh, wow.
So you're not diagnosed. in that 5 to 10 year period, from 1 to 3 to get to 4, the people are already having heart attacks, cancer, strokes, high blood pressure. They're even talking about limiting the term prediabetes to just name it diabetes right off the bat.
But from these early stages.
But they are not doing it.
Oh, I see. Yeah.
You go to general screening tests they're running on patients today. They're not ordering serum insulins except for a rare doctor.
So what you're saying is that by the time most physicians tell somebody that they have type 2 diabetes, the disease has already begun to do some serious damage.
Absolutely.
Okay.
That body, to me, because know a little bit because I read about it and lived through it, that I consider people stage 1 or 2 that their bodies are on fire. Their vascular system is inflamed, and it's because of the food that they're eating. So to get to normal weight is extremely important. South Vietnam, Saudi Arabia, not North Korea, I bet they don't got it, and South Korea, Europe, tremendous amount of type, it's an epidemic in the world. And I'm not recommending a diet here, eating differently. So to get to normal weight, remember 25% of people, I call them the skinny fat people, especially in Asians who have this, they have fat sitting in their liver. So you don't see it externally, and there metabolically it's causing a lot of trouble. So blood testing is critical.
So you can't just judge by your weight either, and that's
25%. The weight won't do it.
I think that's an important message for people too, because that's one. I mean, because it's easy to tell if somebody's putting on the pounds. You can just look.
You're looking at a 220-pound person whose blood sugar may be normal. Remember what I said? May be normal, but if they pull the serum insulin, be elevated. They're pre-diabetic, and many of these people have unannounced heart attacks. If a woman has a heart attack, saying pre-diabetes, you know what the odds are of being dead within 1 year?
Well, I know women don't have as good a survival rate.
40%.
Sure. Whoa.
Yeah, and women's angina is different while we're on the subject. Any pain between the umbilicus and the ears, right or left, can be angina in a woman.
So the whole kind of up chest,
in
sort
men,
of
it's
belly
mainly left side, you know what I mean? In women, it can be both sides. I think important point for people to know.
Yes.
I never hardly meet a woman would ever know that. Okay, so critical number 1 is get your weight down. Okay, and I'll show you how to do it in a minute.
Okay.
Not that hard to do. Okay, but the most important thing, I want to get absolutely straight to the public that they get tested. And if your provider doesn't order that test, you insist on it.
You can ask for it, right.
You tell them, I want a serum insulin. A good one, too, is a 2-hour glucose tolerance test where they pull the fasting blood sugar and serum insulin, fasting, 1 hour, 2 hour. Okay? But the simplest and cheapest would be to get that serum insulin. Another good one is triglyceride HDL ratio. Okay? TRI /
I know my doctor always says that.
HDL ratio is a good one too. So you didn't spend a lot of money. A 2-hour glucose tolerance, you got to come back and forth. It's a little more difficult, but I think this would be critical. Now, how do you correct the darn thing? Remember, say get your weight to normal. Easiest way is to eat at least 80% a vegetable type diet. Okay, not 100%. Okay, and cut out animal products. Not total. Don't have to be totally. There will be associations that will say totally. No, who can do that totally? It's not that easy. But about 80%. Most of this diabetes is caused by eating too much sugar. Okay, but 20% is fat. The omega-6 fat, the bad fat, the fats where the animals raised in non-organic manner, where they feed it nothing but genetically modified corn.
And they're not getting any exercise.
No exercise, and they don't remove the excrements, and they put insecticides in there, and you're eating all that, so animal products are not necessarily good for you.
Right.
Matter of fact, if you eat a nutrient-dense diet, that increases your metabolism so much that you burn off a lot of calories just eating that way. Not all vegetables are absorbed. You excrete 30%. So if you want to lose a bunch of weight, eat a whole bunch of vegetables and carrots and whole grains, and you'll lose weight quickly.
Now, would you make a distinction? I mean, there's a lot
Yeah.
of talk in there about glycemic index and stuff like that, and
Yeah.
high glycemic vegetables like white potatoes and things. Can you say something about that?
This is a good point. I mean, it's a good idea to pay attention to the glycemic index. And what that is, you can go on the computer, glycemicindex.com. It comes from Australia. And other books too, and their list of foods 0 to 100. White bread would be 100 points, okay? A bean might be 20, okay? So to pick foods 50 or less, I think it's good because it won't raise your blood sugar as much. That's managing diabetes, okay?
Yes,
But we want to get rid of it. Eat high fiber foods, for example.
Okay.
Cruciferous vegetables.
Which would be like broccoli and cabbage.
And cabbages and stuff. If you eat a meal like that, have a soup like that, your blood sugar won't raise up and you will lose weight. Exercise is important because it improves the metabolism of your body. But you have to remember, exercise, what do you burn in an hour? You know, I see people where I work out, they come in there and they're way overweight, a lot of them, and I go there because this place has a lot of people in there, and I like to see that they're there. But you burn 150, 200 calories. You need to burn more than that. So you have to watch what you eat. Did I say diet? If you eat a nutrient-dense way, nutrient-dense, vitamins, 12, minerals, 14, 25,000 phytochemicals, those are the phenols, the carotenes, foods of color, okay? And it's their interaction, their symphony, their orchestra, their rainbow of interaction, the enzymatic activity lead to good health.
Well, and I've heard people talk about like trying to make your plate colorful, you know. Eat dark colored purple vegetables and oranges and yellows and reds.
Exactly. Half your plate should be vegetables, you know. Another quarter whole grain, where these grains have still the coverings on them. You asked about potatoes. I mean, if you're diabetic, I mean, potatoes don't have any nutrients in it, you know, very few. A little bit in the covering maybe, but it's sugar, you know what I mean?
Yeah.
So although I eat a baked potato here and there, because, you know, I weigh 139 pounds, I can afford it. And I love a potato, but if you're diabetic, that would, increase your sugar right away.
Well, and that's that glycemic thing again. You become sugar so quickly.
Exactly.
It gives you this.
And let me tell you about table sugar. I talk to very few people who know this. Table sugar, sucrose, is 50% glucose. Okay, all right. What's the other 50%? Fructose. You know it.
I've watched your program.
You watch my program. It's fructose. Fructose goes to the liver, doesn't raise the insulin level, makes very low density LDL, and that's the one that burrows in your arteries and causes arteriosclerosis. It's not the fat. A little bit of the fat, the omega-6, but it's mainly the sugar. It's a fructose and sugar. So 35 grams of fructose a day is okay. 2 or 3 pieces of fruit is fine. You know what I mean? But if you're going to eat 10,
fruit comes in a package with other things.
You know, you know what I mean? Yeah. I mean, that's fine. I'm not saying you can't eat that because of the fiber, but you have to watch the amount. Fructose corn syrup, you know, for example, honey, for example, full of fructose, and it will cause quick weight gain. It will cause that fire in your body.
Oh, that inflammation you're talking about again. Yes.
Yeah, your 300,000 miles of capillaries in your body, and even insulin. If your insulin goes up because you're eating sugary foods, that inflames those vessels.
Okay.
Yeah, insulin doesn't just get that sugar down, bring sugar into the cell. It also helps cause arthritis. You'll notice most diabetics have had hip replacement, knee replacement. It's because they deposited advanced glycation products with sugar and protein in their joints, destroyed their joints. It'll also deposit in their brain.
Not good.
One of the complications of type 2 diabetes is dementia. They'll call it Alzheimer's disease. They even call it diabetes type 3. It's not Alzheimer's disease, but it's severe dementia. Type 2 diabetics have a lot of memory loss problems. You know, say, well, you have Alzheimer's disease. Well, that's not really it. But it's preventable. So I can, by getting to normal weight and exercising some every day, even say walk half hour a day, okay, do more if you can, you can eliminate this illness, keep you out of the nursing home. What do you think is full of nursing homes? What's full of intensive care in these hospitals? It's people who had heart attacks, and you say, do you have diabetes? Well, many are undiagnosed.
Yes,
and some are diagnosed.
Yes.
And you can avoid that visit in the nursing home. You can avoid that dementia. You can avoid that arthritis. You can avoid being amputated. A lot of people get a toe amputated. A lot of them are gone in 2 years.
Yeah, yeah.
'Cause
Well, it's a pretty
Yep.
severe sign if you're
Yes.
already having those limbs not getting the right circulation and the tissue is dying.
And that's not the only place that the vascular disease is. You get it in your legs. They need to. Your toe is black.
Yeah.
You get it in your brain. You get it in your heart. All this. The good news is, again, Rudy's good news. 90% can be avoided by eating properly. No diet. Let's take that plate again. You know what I mean? Half vegetables, half whole grain. I mean, quarter whole grain. The other quarter can be protein, can be some animal products. But if you eat less animal products, you lose weight quicker because it takes more to metabolize the vegetables.
Now, you didn't say anything on your plate about fat. Where does fat fit in there?
Okay, it's a good question. If you're not eating animal products, you're cutting out a lot of the fat. Okay, and the theory of cholesterol is kind of going down the tubes.
Yeah, I've noticed that. Yeah, I've heard that.
You noticed that? Yeah, it's kind of going down the tubes because for 40 years they told us fat was the problem. It was sugar, and they knew better. It was the industry. Yeah, and the associations are getting paid money from industry. Yeah, and it's the sugar is the main enemy. If the fat is from natural, guacamole, for example, if it's from nature, it's okay. It's okay. There's some fat in every vegetable that you eat, a little bit in the membrane of it, because that's how it picks up the energy from the sun through.
So even lettuce has a tiny bit of fat in it.
Yeah, but it's a good fat, linoleic acid, alpha linoleic acid. See, we need some essential fats because they are in every membrane of our body. They are in every one of our hormones. You need some fat. Okay.
Well, and the name says it, doesn't it? Essential fatty acids.
Essential fatty acids.
You can't do without them.
You don't want the omega-6s, they're pro-inflammatory. You can even need a little bit of that. Okay. But like I said, if you want to lose weight quickly, watch your sugar and kind of decrease animal products in your life, and the weight will just drop off you. And put the food plate. You can get it off my website, Rudy's Food Plate. And I wouldn't. I'd watch the gluten a bit, you know what I mean?
Oh, I'm gluten intolerant.
You know what I mean?
You're
People are intolerant.
To the choir here. Yes.
Not enough tests are run for that. A lot of pot bellies, wheat bellies. I do the wheat. So you have to watch that a little bit. And read about milk. Make up your own mind, okay? But so much of the literature today, in my opinion, too, after age 2, we shouldn't be drinking milk because of the casein in it and the lactose, the milk. The casein is very carcinogenic.
And that's the protein in milk.
It's a protein.
That's my understanding, yes.
Children have an increased rate of type 1 diabetes who drink a lot of milk.
Cow's milk.
Yeah. Read a book. It's easy to remember. Key on whitewash.
Okay.
This thick. If you still drinking milk after reading that, I would be surprised. But I want you, people listening, read it. Make up your own mind, okay? And I want you to be last word because you can go to many pediatricians. They'll tell you, oh, did you have your milk today? They haven't read that book.
And can you say something about, because I think the big push for children to drink cow's milk growing up was because of calcium, and they needed the calcium. Where else can we get calcium?
Oh, it's in vegetables. Sesame seeds is full of calcium.
Okay.
Spinach full of calcium. Yeah, that's irrelevant today. Yeah, that's just industry advertisement. They convince a lot of
There's
people.
lots of ways you can get
other ways you can. Don't even need to take a supplement. Get it out of your vegetables. Incidentally, we talk about foods of color. You know what I mean? You notice we're dressed in color.
Yes, we are today.
Foods of color.
Yes.
And I think that's. But onions and mushrooms, you don't have color, but they're full of phytochemicals. So people should eat beans, mushrooms,
garlic,
and hummus is a good one to use as a snack because you all want a snack. Hummus is made from sesame seeds and choy seeds and some garlic, a little bit of olive oil. People asked about olive oil, for example. Has some omega-3 in it, but not a lot of it. It's 100% fat. You know what I mean? You want to lose some weight. So the critical thing to get rid of this diabetes thing is, number one, get tested. You know what I mean? And
Know where you stand.
Know where you stand and learn about the nutrients in food. This is not complex. You know what I mean? And people will teach to, well, watch the portions. I didn't say to watch the portions because the nutrients, the phytochemicals in food, that's right out of Dr. Furman's book, I Used to Live, who was a friend of mine, who I've beat in tennis twice in a row now, and I mentioned that. And those nutrients in the phytochemicals will turn your appetite off. Yeah. Yeah. You won't feel like eating.
And I think that is one of the fears when people think about, oh,
yeah.
I'm gonna be starving myself.
Yeah. You can detox away from sugar. Remember, sugar is more addictive than cocaine.
Yeah.
Our brain likes it. Hell, I like it. You know what I mean?
Yeah, we all
so
like it, right?
we all like it. You know what I mean? Right. So, but it's quite addictive. And so, but to eat less of it. Did I say none of it? No, less of it will reduce your addiction.
Okay.
You get over it about 3 weeks or so. I don't crave that donut, you know what I mean? I eat seafood, I see.
How wonderful.
I eat.
Yeah,
now
right.
I see a donut, kind of turns me off.
Well, Dr. Rudy, we're going to have to wrap up in a minute.
Yeah.
This has gone so fast.
Yeah.
Where would you suggest that people start if they've got concerns about their own diabetic health?
Blood, suppose they're not diagnosed, suppose they're 200 pounds or 10, 15 pounds overweight. Get a serum insulin, fasting blood sugar, HbA1c from your provider, and maybe your triglycerides, HDL ratio, get that down, test it.
Yes.
Number one, to gain some information, okay? Books I would recommend, End of Diabetes by Dr. Furman. I wrote a book on it also on Amazon. And get informed, get information. And then, but it's not hard.
Well, that is just great. That is where we have to start.
Yeah.
I think this has been such a productive conversation. I really appreciate your coming. I'm so excited about what you have to say, and I know people in our community will be too. Thank you so much for joining us today. Again, this is Dr. Rudy Cashman. I'm Paula Jamison with Public Media Network in Kalamazoo.